y'all. Here we are at Dr. Janet Blanchard's office. We're going to go in and talk to her and maybe get a little synopsis of what she's going to do to my face.
Hi, Paula.
Hi, Tracy. Tracy's one of the nicest ladies, and she works for Dr. Janet Blanchard, and she's going to help take care of me.
This is arnica. It helps reduce the bruising and the swelling. It's all natural.
Okay.
You're going to want to start this the day before your surgery.
The day before.
The day before, anytime the day before.
Okay.
And then you're going to take the next one 6 hours after surgery.
Okay.
And then bedtime day of surgery.
Okay.
And then days 2, 3, and 4, you're going to take it morning, noon, and night.
Okay.
Each tablet is marked on how you're supposed to take it off, so that's inside the box.
Okay.
Okay?
And I'm supposed to start eating the fresh pineapple next week leading up to my surgery. Okay.
Mm-hmm. Yes. This is going to be your chin strap. I'm going to show you how this works.
My mummy wrap.
That's right. Okay, so when you take all your bandages off, you're going to put this on, and I'm going to show you in the mirror too. So you'll put this on. Okay.
How attractive.
How do I look?
You look wonderful,
Then this
Paula.
strap will go on in front to hold it in place. And this strap will go on in the back.
Now, Tracy, how am I supposed to put that on back there?
You will be able to in the mirror. I'll show you what it looks like.
Well, Paula, this truly is a new you.
Oh, I look like a bad victim, don't I? Oh, Brian's going to yell about the hairdo.
Let's talk about what we're going to do. I'm going to talk briefly about what we're going to do.
Okay.
This is non-invasive, not as invasive as a regular facelift. It's a procedure we're going to do in the minor surgery room with you awake but with something to make you sleepy, just like twilight sleep, just like any other, you know, if you had a colonoscopy or something.
Okay.
Okay? So you don't have to be in the hospital, in the operating room with drains and nerve damage and staying overnight. There must be a downside to this, and the downside to this is that you can't expect to get the same results with this because it's not as invasive.
Right.
The incisions for these are the same as a regular facelift, but they're not as extensive. So I'm going to start with an incision here. I go around your ear, I go around this curvature. I don't go straight in front of it because I think it leaves a scar that you can see.
Okay.
I go around your ear, back into the crease here, and then into your hairline. I elevate the skin to about here.
Now, elevate. What does that mean?
That means I separate it
Bring
from
it
the underlying.
okay.
No, I elevate it. I separate it.
Okay.
I pick it up.
Okay.
I think it's there's some technical thing that you don't want to know about.
Okay, I don't want to know.
No. Regular facelift, you elevate the skin all the way to here and all the way into the neck. So you can see how you can recruit more skin. Now there's a layer underneath the skin that helps do this. It helps accentuate your jawline. And it's going to feel tight when I do that, and it's going to stay feeling tight for 10 days or so after. Okay, so just so you know, it's a good tight. Okay? I sew you up, I put stitches underneath the skin and on top of the skin that don't have to be removed, they dissolve. Now sometimes they don't dissolve and come to the surface and poke at you and we have to take them out. What I'm going to do with you is I'm going to put your chin down a little bit. So I'm going to do some liposuction in here and right around here. Now what this is going to do for you is it's going to minimize these lines here and minimize this and kind of volumize your face a bit. That's what happens as we age. Everything that was up here goes down here. So when you go home and look at yourself in the mirror, just do a little bit of this and you can see, right, that's what you want.
It's going to be nice.
So I'll make an incision. This is looking at you from the worm's eye view underneath your chin, and I'll put these two muscles together and after I've liposuctioned.
Okay.
Once I do that, I put you in a dressing that looks like a football helmet or a mummy, and I send you home. This is not excruciatingly painful, but it is uncomfortable because when you make incisions on the front and the back of the ear and plaster them in a dressing, it's uncomfortable. So I do give you some medication to take the edge off. I'm going to give you 4 different medications. One for pain. So if you have pain, it's Percocet, PP. Sometimes because I tighten this up and tighten this up, it feels tight, and it doesn't. It's not painful, but it's tight. So I give you some Valium to have for that. So it's PP, and if it's tight, Valium, TV.
TV. Tight Valium. pain Percocet.
Right. I'd like you to sleep with your head elevated. Do you have a lounge chair somewhere? Or a recliner?
I have a chaise lounge.
You might want to get a wedge pillow or something.
I did. I already bought a big round bolster that goes all the way across the bed,
so that
and a large pillow so that I will be sleeping
perfect
like this.
Okay, good. And I'd like you to sleep that way probably for 5 to 7 days.
Okay.
I'm going to put you in a dressing that looks like a football helmet or a mummy. On the 3rd day, we have you take the dressing off, go to the shower, wash your hair, and then Tracy showed you how to use this chin strap.
Yes, put it around like this and
Right.
behind.
You'll put that on after you've showered and washed your hair, and we give you some instructions as well.
Okay.
And you'll wear this chin strap as much during the day as you can for the rest of that first week, and always at night, and then at nighttime for the next couple weeks.
Okay.
Your downtime is going to be how bruised and swollen you are.
Okay.
I say 10 days to 2 weeks. Some people come in here in a week and they look pretty good. Some people come in here in a week and look like I've punched them. For the first 7 to 10 days, I like you to eat soft foods because you're going to feel tight, and when I tighten this layer up, I don't want you chewing, like chewing gum, chewing meat. So oatmeal, cream of wheat.
She hates oatmeal.
All right, I don't care. Yogurt, whenever you can put in a blender. Soup, eggs,
Scrambled eggs are okay. Soft
mashed
scrambled
potatoes, macaroni, you know, that kind of stuff.
eggs. Very soft foods.
Soft foods. We call it a weight reduction diet. I had a patient in here today who said she lost 8 pounds last week. Wherever I operate, you're numb. And it's not a functional thing, it's from the inflammation from surgery. So as that inflammation resolves, the numbness will dissipate. It takes anywhere from 3 to 4 weeks to 3 to 4 months for that to dissipate.
Okay.
And sometimes you'll come in here and one side's numb, the other doesn't go, and you'll say, well, I'm more swollen on this side, but it's because you're numb, not because you're more swollen.
Okay.
The scars in front of your ear will be pink for 3 to 4 months, and in the back, they may be pinker and lumpier longer.
Okay. Now, do we have to like remove any hair or anything?
No, I do not shave the hair.
Okay.
No, not at all.
Okay.
I don't know how long this lasts, but what I'm going to tell you is people are going to say, you've changed your hair, you've lost weight, you've done something different, but you're just going to look like a little younger version of you. And what it's going to do is it's going to clean up your neck and your jawline here. No exercise for a month. I'm doing all this, no that, but we write.
No exercise is okay.
You can walk after the first week, okay?
Okay.
I don't want you to take the pain pills on an empty stomach as well, because they may make you sick, okay?
Okay.
But she's going, you're going to the eye doctor tomorrow.
Oh, yeah. I showed you the allergy medication. You said it's okay to use in there. Now, if this turns out to be like conjunctivitis or something, and he prescribes an antibiotic,
We're 2 weeks out.
So
You'll
she
be
can
fine.
take that.
Yeah,
Oh,
absolutely you can take it.
okay.
Whatever, you just don't need to, we gave you a list of things you
I
should-
know, and I've been adamant. I won't take anything. I have to think 3 or 4 times before I even take Tylenol.
Good, okay, good. All right, I need to take some pictures today.
Okay.
All right.
So our next step then is to
Wash
see you
with
at the
it.
hospital.
The
Wash your,
dial soap.
right,
The night before and the morning of.
and wash your hair with your regular shampoo.
Wash good.
Do not eat or drink anything after midnight. When do you take your glucophage?
Usually in the mornings, but I mean I can adjust that. I can take it like at 7 p.m. the night before. It's extended release, so.
Okay, because you're not going to be eating in the morning, so I don't want you to have a low blood sugar, although we're going to be starting an IV. So if you want to brush your teeth in the morning, just spit the water out. And when I see you in the morning, the nurses will have started an IV, given you a pill and a shot. And you won't think you're relaxed enough, but I won't give you any more medication until we get you into the room. Then you won't care where you are, nor will you remember.
That's okay. I trust you.
Good. All right, let's
And
do it.
really looking forward to it.
Yay.